Hello, everyone. Good morning, good afternoon, good evening, and welcome to this FIP digital event on climate change as a risk to respiratory health. Next slide, please. My name is Gonçalo Souza Pinto. I'm lead for practice development and transformation at FIP, and I have the privilege of being the moderator for today's event. A few announcements to make before we start with the webinar itself. We would like to share with you that the webinar is being recorded, and the recording will be available on the YouTube channel of FIP. It's also being live streamed on that same YouTube channel. So you'll be able to revisit or share the recording with your colleagues after the event itself. You may also use make questions to our speakers today, and we do encourage you to do so using the Q&A box provided. Sometimes some colleagues use the chat function for that, and we do advise you to use the Q&A tool so that the questions are sent to our speakers, then they can respond to them and not be missed among other comments made on the chat box. Finally, you're also very welcome to share any feedback you may have on this webinar or any suggestions for our webinar program by writing to us at webinars@fip.org. And finally, if you're not a member of FIP yet, we do invite you to consider the benefits of becoming an individual member of FIP. And you can find all the information about this and actually register to become a member at the FIP website, on the website that is written on your screen. You can see it there. So today's webinar and event is about the impact of climate change on health, on respiratory health in particular. We know that climate change predictions indicate that the situation may actually worsen in the coming years, especially if no urgent and collective action is taken to refrain climate change and to stop some of its effects on the global ecosystem. And these changes have a clear, both direct and indirect effect on health of all species, humans included, and therefore we need to consider this as a healthcare profession, and how pharmacy may respond and help our communities and support patients and communities in minimizing this impact of air pollution and climate change on their health. So with that in mind, we organized today's event and we gathered together an excellent panel of speakers with the aim of supporting pharmacists around the world to play a proactive role in respiratory management of the health impact of climate change and air pollution, by helping to address their practice and education needs to enable them to provide better patient advice and self-care. Next slide, please. Thank you. So some of the learning objectives for today is really one of them to identify the changes in climate, as well as the interrelationship between climate change and air pollution. We know that climate change will affect health in multiple ways, including by changing the geographical distribution of some pathogens and in many other ways. But one way, and we've just seen, for example, the catastrophic effects of climate change through the floods in Pakistan, or the record high temperatures and droughts all over Europe and other regions. So we know that climate change will have a very direct impact on our lives. But one of the ways is really through the impact of air pollution. And so we'll be discussing that, what elements of climate change will have an impact on health, and also understand the impact of climate change and air pollution, particularly on respiratory health and conditions, and understand how climate change and air pollution affect particularly people living in low and middle income countries. And we know that climate change disproportionately affects these countries, and that sometimes and most times many of these countries are actually not the highest net contributors to climate change. So clearly there's an imbalance in terms of how climate change affects us around the world. Then we will also learn about the interventions, treatments, and management strategies, including self-care measures on how pharmacists may minimize the impact of climate change on respiratory health. And finally, to recognize the role that pharmacists must play to support better health care delivery and patient care. Thank you very much. We appreciate and would like to acknowledge the support that the Clean Breathing Institute has provided for this event. The TCBI is a scientific initiative funded by Halium. Thank you very much. And today's panel, we're honored to have such an excellent panel of speakers today. Some of them have collaborated with FIP in previous events on related subjects. Some are new, and one of them is our dear colleague. We'll start with Professor Fan Chung, who is a professor of respiratory medicine at the National Heart and Lung Institute at the Imperial College in London. And I will, Professor Chung has recorded a presentation. He will be he's with us live today and will be participating at the discussion towards the end of the event, but we will be sharing his presentation. So allow me just to introduce Professor Chung before giving him the floor for his presentation. So Dr. Chung contributes his respiratory expertise to a variety of research initiatives. He has been co-leader of the Unbiased Biomarkers for the Prediction of Respiratory Disease Outcomes project, studying severe asthma, and he's an investigator at the Medical Research Council on Asthma UK Centre in Allergic Mechanisms of Asthma, and at the MRC Public Health England Centre for Environment and Health at the Imperial King's College in London. Dr. Chung also serves on the editorial boards of several respiratory journals. He has published extensively on the topic of respiratory medicine, covering mechanisms and treatment of chronic airway diseases, the impact of environmental air pollution and nanoparticles on the lungs and in lung disease, and on potential treatment options relating to antioxidant therapies. So without further ado, I ask my colleagues to put up the presentation by Dr. Chung on the challenge of climate change and health. Time to act. Thank you very much.
So this morning, I'm going to talk to you about the challenge of climate change and respiratory health. So climate change impacts a wide range of health outcomes. And this slide that I've obtained from the Center for Clinical Diseases in the US illustrates the most significant climate change impacts, which are more extreme weather, rising sea levels, increasing carbon dioxide levels, and rising temperatures, and how this leads on to various subsequent health outcomes. So for the purpose of my talk today, I'm going to talk about the effect of extreme heat, effect on air pollution, in relation to respiratory disease particularly. But Dr. Wong will talk about the effect of climate change on increasing allergens, which has an impact on respiratory allergies and asthma. And Dr. Salvi will talk about how this affects countries of low to middle income. So these are the medical conditions that are affected by climate change. And it's not only respiratory conditions such as asthma and COPD, but the other non-communicable diseases that are very common in the world, diabetes, cardiovascular disease, and also Alzheimer's disease and mental illness. And of course, other groups such as obesity, those with physical disability, and the young and elderly particularly, are also going to be most affected by climate change. And these are the reasons why these medical conditions have been mentioned, because these be particularly affected in terms of cognitive impairment that would lead to difficulty in response to the emergencies that we see a lot with climate change, and also the increased sensitivity to heat stress the changes in pollen season and sensitivity as a result of changes in weather events, the increase in air pollution, and the increased risk of respiratory, particularly viral infections. So just a few minutes to talk about the increasing problem of exposure to hot weather and heat extremes, and this is increasing, and is illustrated by this increasing global heat-related mortality, particularly in those over 65 years old, since the start of this century, so over the past 22 years. And just to give you an impact on mortality, we could take the example in 2010 of the heat wave that occurred in Russia over a couple of weeks, during which time they reported an excess of 55,000 deaths due to this hot weather during those few weeks. And the effect of hot weather, of course, is to induce stress on the heart, because the vasodilatation that occurs in hot weather, vasodilatation being a way in which heat is dissipated from the body to the external environment. And so this effect on the heart is to reduce stroke volume as a result of this central hypovolemia. And obviously people with cardiovascular disease and respiratory disease would feel the strain from this. But there's also another possibility in which heat extremes can activate the immune and inflammatory systemic response that can lead to organ failure, such as acute respiratory distress syndrome, which obviously is very serious when this happens, particularly if you have underlying respiratory disease. Now, there's been literally little research in terms of the effect of high temperatures in people with asthma, particularly. But this study shows that asthmatic adults, when exposed to extremes of ambient temperature, is associated with a fall in lung function, particularly in FEV1, as illustrated in this part of this graph here. And you can see the effect in reducing FEV1, particularly at low temperatures, but also at high temperatures, particularly above 30 degrees C, with this abrupt fall in FEV1. And in this study, they found that particularly people male and overweight were particularly sensitive to this fall in FEV1 at both extremes of temperature, but at low temperature particularly, you got also people, older people are becoming mostly affected. So I now want to move into air pollution, because this is a very big thing about air pollution, because what drives climate change also drives air pollution. So the drivers of greenhouse gases, such as industry, in terms of electricity and heat production, or in terms of use of transportation, building buildings, and agriculture and forestry. These drivers of climate change are also drivers of increased air pollution production. And furthermore, with climate change occurring as a result of greenhouse gas effect, you have the outcomes of climate change in terms of increased forest fires, increased storms because of weather changes, and then more importantly, increased ground level ozone, a very important component of air pollution. What about the effect of air pollution, climate change on the respiratory disease? And here, I think it's important just to make an emphasis on the fact that air pollution is not only about outdoor pollution, but also about indoor pollution. And it is quite clear that you will get also an increase in indoor pollution because of the seepage of increasing outdoor pollution into buildings, into homes. And there are also other components that are increased with climate change that can be present inside the home, like the increasing pollen inside the homes and increasing molds also as a result, again, of high temperature and humidity, etc. So the respiratory effects are summarized here in terms of short and long-term exposure. The short-term exposure, we all know this, the increase in attacks or exacerbations of asthma and COPD, and also recent evidence that there's also an increase in exacerbations in people with bronchiectasis. And also the increase in upper airway viral infections that can also contribute to the occurrence of those exacerbations in those respiratory conditions. In terms of long-term exposure, well established now that there is reduction in lung development in children exposed to high level of pollution, and evidence accumulating about development of lung cancer, and also in terms of development of asthma and COPD themselves. So not only worsening asthma and COPD, but inducing development of these lung conditions. There's also some evidence in terms of idiopathic pulmonary fibrosis. And over the past couple of years, with the SARS-CoV-2 pandemic, we've come to realize that the outcomes of people who got the SARS-CoV-2 infection, particularly with pneumonia, the outcome is worse in those people who live in highly polluted areas. So what can we do about air pollution? And I think here it's important to go into the recommendations that were made at the UN Climate Change Conference last year in Glasgow, a recommendation to prioritize health and equity. And I'd just like to focus on recommendation 5 and 6 because these relate really to the crux of the problem of air pollution, and obviously the source of air pollution needs to be controlled, and this is through transition to renewable energy and moving away from other energy sources like coal combustion. And there's also this recommendation to end energy poverty in households and healthcare facilities. And then the 6th recommendation, which is really coming to a personal level, in that everyone is affected by this, in the sense that everyone needs to consider promoting sustained healthy urban design and transport systems, and use green public spaces in order to do exercises such as walking and cycling, and which is good for health. But there are other recommendations that can be done at a personal level, and this is what I'd like to end up my presentation with. A couple of years ago, we published these recommendations that came from an analysis of what's already been published, and we got the evidence from the literature. So we've looked at various mitigation strategies, looked at whether we can detect people at particular risk of getting respiratory problems with exposure to air pollution, about strategies regarding people already affected with COPD or asthma, and then whether there were any effect modifiers that can be recommended. I just want to end up on 2 recommendations in which I think we need to do more work and try and establish those recommendations. First of all, the use of portable air cleaners as an indoor environmental intervention. And as you can see here, this recommendation was supported by evidence grade C, which means that we need to do more research in this area to see how this can benefit particularly our patients with asthma and COPD, and the way in which these can be implemented. And finally, as a respiratory physician, I'm particularly concerned with whether there are any ways in which we can improve the treatment and management of people with respiratory conditions, particularly asthma and COPD, at a time of increasing exposure to air pollution. The recommendation that we have here is that only at an evidence grade D, which means that we need to have much more work here. And of course, maximizing control of airway disease through optimized care is the way forward, but there must be other means by which we can improve the outcomes through optimized care. And then finally, in terms of promoting those interventions, which are quite obvious, we do lack the ways in which we can implement those interventions, and we need to find out how we can do this. So thank you very much for your attention.
Thank you very much, Professor Chang. That was a brilliant overview of the impacts of climate change on health and some key areas where intervention may be required and some opportunities to intervene by health professionals. We will now continue with another recorded presentation by Dr. Sandeep Salvi. Dr. Salvi is founder and director of the Chest Research Foundation in Pune, India. He also serves as adjunct professor at the University of Pune and Symbiosis International University, and as a visiting faculty at the Imperial College London in the UK, and at the Johns Hopkins University in Baltimore, USA. Dr. Salvi is a member of the Steering Committee on Air Pollution and Health with the Government of India's Ministry of Health and Family Welfare. He's an international advisory board member of the Lancet Respiratory Medicine and a member of the board of directors of the Global Initiative for Obstructive Lung Disease, or GOLD. Dr. Salvi has published widely, covering topics such as the effects of ambient air pollution and household air pollutants, such as biomass cooking fuel, mosquito coils, or burning of incense, on the lungs, and has done pioneering work on non-smoking COPD. It is our pleasure to have Dr. Salvi as a speaker today, and I welcome his presentation. Thank you very much. Dr. Salvi will be focusing particularly on the impacts of air pollution on health in low and middle income countries. So that's a very relevant and important topic to address. Thank you.
I'm here to talk about health impacts of air pollution and climate change in low and middle income countries of the world. I'm Dr. Sandeep Salvi from Pune in India. The world is indeed getting a hotter place. Over the last 50 years, temperatures across the globe have increased between 1 to 2 degrees Celsius. And this has largely been attributed to the large amount of combustion of fossil fuels that we use because of our urbanization. Every second, 116 million liters of gas and 171,000 kilograms of coal are burnt every second. And because of this, the combustion produces carbon dioxide and methane, which are important sources of global warming, being greenhouse gases. 84% of the global population live in the low and middle income countries of the world. Out of the 215 countries in the world, 135 are those that are low and middle income. In this figure, you can see that the blue shades represent upper income countries and the yellow and the brown shades represent the low and middle income countries of the world. So clearly, the low and middle income countries of the world account for a very large global population and are therefore more vulnerable to the harmful effects of climate change and the impact that it has on air pollution. Among the 10 leading countries in the world that are afflicted by air pollution, 9 of these are from the low and middle income countries. These countries have been facing the mammoth task of deaths and suffering due to communicable diseases such as HIV, tuberculosis and malaria. But the impact of air pollution in these countries is 3 times more than the combined effects of what I've just mentioned to you. India, China, Pakistan are the top 3 leading countries in the world that have significant impacts on health due to air pollution. Ambient air pollution is produced by various sources. Motor vehicles, the exhausts that come from the burning of petrol and diesel account for a significant proportion of the ambient air pollution. Road dust is another source. Industrial sources, the burning of crop residues, burning of garbage, and the burning of dried leaves are all very important sources of ambient air pollution in most of the low and middle income countries. The research on the exposure to air pollutants, and especially PM 2.5, which is one of the leading air pollutants that has an impact on health, has been very poor in the low and middle income countries. As you can see in this study that was just published, the purple colors represent the number of papers published from high income countries, and the shades in blue and green are the ones that represent number of publications from low and middle income countries. So up until very recently, the only research that has been done was in the upper income countries, while over the last few years, there has been an increasing number of publications on the ambient levels of exposure to air pollution in LMICs. This is a graph that shows you the comparison between the ambient levels of different PM 2.5 levels across the globe. The upper income countries on the right hand side of the graph are the ones that are closest to the WHO recommended safety limits. And on the left hand side, you see the low and middle income countries which have annual average PM 2.5 levels in the extremely dangerous zone. The grey bars represent the rural community and the yellow bars represent the urban community. So clearly there are more PM 2.5 levels in the rural communities in the LMICs compared to the urban cities. The sources in the rural areas, they include cooking and heating as an important source, whereas in the urban areas, it's predominantly the ambient air from motor vehicles and road dust and so on. So clearly, the levels of exposure to PM 2.5 in LMIC is extremely high. You can see that the graph that I just showed you excluded 2 very important and large cities. One is Delhi and second is Daegu, which had levels which were extremely high, and therefore they were excluded as outliers from this graph. But that clearly tells you that the levels of PM 2.5 are very, very high in the LMICs. Household air pollution is clearly an important and a major risk factor or a source for air pollution. Burning of biomass fuel, be it wood, be it animal dung or crop residues, are an important source of indoor or household air pollution. Compared to 1.1 billion smokers in the world, there are 3 billion people in the world who use biomass fuel for cooking, and they are the ones who are exposed to very high levels of indoor smoke. This lady from India who cooks food for the family is exposed for anywhere between 2 to 4 hours every day to the smoke that comes out from the burning of wood and animal dung. And over her lifetime, she would have inhaled around 25 million liters of this highly polluted air. Not only her, but the children who are always with the mother when she's cooking are also exposed to high levels of air pollution during their early years. Household air pollution has been shown to emit more than 50% of all global black carbon emissions. And it has been known that black carbon is a greater source of climate warming, global warming, than what carbon dioxide does, up to 1,500 times greater for global warming than carbon dioxide. And therefore, the black carbon emitted from the burning of biomass fuels is one of the leading sources of global warming. This is a study that looked at the impact of air pollution in people who live in the low and middle income countries versus those who live in the high income countries. You can see that people in the low and middle income countries, they account for about 99.8% of the overall health impact. This is a very large study conducted in 123 countries and a combination of 476 studies. And you can see in this second part of the slide the health impacts due to the air pollution. You can see that asthma, COPD, acute respiratory tract infections, both in adults as well as children, lung cancer, cardiovascular diseases that include ischemic heart disease, strokes, stillbirth and low birth weight are all important health impacts of air pollution in the low and middle income countries. An estimated 120 million people suffer from a lower respiratory tract infection, of which 8 million require hospitalization, and around 1.1 million children under the age of 5 die every year because of pneumonia, and 50% of these pneumonia deaths are attributed to household air pollution. Ambient air pollution and the impact of acute respiratory tract infection has been more recently reported in this very large study published just very recently. More than 500,000 children under the age of 5 years from across 35 developing countries. And you can see that the impact of PM 2.5 air pollution, every 10 micrograms per cubic meter increase in PM 2.5 has been shown to increase the odds of having acute respiratory tract infections by around 6%. Boys seem to be more affected than girls, younger children more affected than the older, and children living in the rural areas are the ones who are more affected. What is the impact of household air pollution on stunting? So children who are born in homes that use biomass fuel for cooking, does it have an impact on their growth or stunting? And this study clearly highlighted that use of biomass fuel or solid cooking fuels at home have a significant impact on the children's growth. The incidence of stunting is increased by around close to 60% among those children who live in homes that use biomass fuel for cooking. This is a study that we did in India that compared the lung health of children, adolescent school children living in Delhi versus children living in the cleaner cities and towns in India, in south of India. So Delhi is in north of India and the cleaner cities were in south of India. Study done in close to 4,000 children. And you can see that the prevalence of sneezing, watery eyes, itchy nose, itchy rash, shortness of breath, chest tightness, and eczema were all significantly higher in children who were living in the polluted city of Delhi. We also found that the prevalence of spirometry defined obstructive airway disease was much higher in children from Delhi as compared to those who lived in the relatively cleaner cities in India. And one important observation that we made was that air pollution was an important risk factor for developing obesity as well. So air pollution has an impact on asthma, air pollution causes obesity, and these together increase the odds of developing asthma. So that's the overall impact of air pollution on health. So to summarize the impacts of air pollution on health in LMICs, you can see that almost every organ is affected, be it the growing fetus or the lungs or the heart or the vascular system, the endocrine system, the neurological system, or even the reproductive system. And more recently, we have been able to show that obesity is indeed one of the health impacts of air pollution. So what do we do? What is the solution for this, especially in the low and middle income countries? Obviously, it is important to reduce the sources of air pollution. And that would need to be done by the policymakers and the politicians and the government of all these countries. But what could the individuals do? They could protect themselves from being exposed to higher levels by wearing masks, by wearing nose shields, which are now have been shown to be quite effective, and regular cleaning of the nose has been shown in the ancient traditional system of India of cleaning the nose. One of the good things that happened in the COVID pandemic is the behavioral change of people to start wearing masks. And I believe that people should continue wearing the masks even after the COVID pandemic is over, because that is going to protect them from the high levels of air pollution that they breathe. So that is one potential solution. The other way you could do is improve ventilation in the house wherever it is not possible to replace the solid cooking fuels. Improve ventilation is going to be a simple but effective means. Regular exercise and a healthy diet that comprises of vitamins and antioxidants will indeed protect these individuals from the harmful effects of air pollutants. So clearly, I think air pollution in the developing countries is a big problem, and it is therefore important to appreciate it and start finding solutions for that. Thank you very much.
Thank you very much, Dr. Salvi, for that brilliant overview. Indeed, we see that how the low and middle income countries are so much more affected by a problem that is often not so much their responsibility or their fault, and that we need to identify measures that can support people living in low and middle income countries to protect themselves from these impacts on their health. Thank you so much. We'll now have our third speaker, Ms. Ravijot Sagu, who is a lead clinical pharmacist at University College Hospital in London. Ravijot has a hospital background in medicine and emergency services with a specialty in respiratory medicine. She's an honorary clinical lecturer for the London School of Pharmacy at UCL. She's also the 21-22 Chief Pharmaceutical Officers Fellow based on the NHS England. She's a coach, independent prescriber, chair of the UK Clinical Pharmacy Association Respiratory Committee, and has been part of the NICE, the National Institute for Health and Care Excellence, and the British Thoracic Society Guideline Committees. Ravijot is passionate about sustainable, personalized, holistic care for patients, population, health, and integrated care to reduce health inequalities. And she's also part of the NHS England Lung Health at Home and polypharmacy work streams, and also a pharmacy specialist advisory committee member at the British Thoracic Society. Ravijot, it is a pleasure for us to have you as speaker today, and we're honored to give you the floor for your presentation. Thank you very much. Ravijot will be addressing the topic of how pharmacists may actually contribute. What is the role of pharmacists in minimizing the impact of climate change on health? Thank you very much. The floor is yours. Ravijot, I invite you to switch on your camera and microphone. You may be muted at the moment. Actually, I think that Ms. Raghu may have lost connection for a moment. So perhaps I would suggest that we move on with the presentation by my colleague, Lina Badr, and then we can return to Ms. Sagu's presentation.
Thank you very much for that, Gonzo. Very happy to do this, and I think it will set the context for Ravi afterwards, because she will be linking a lot of what we heard from Dr. Chong and Dr. Salvi from a clinical point of view to pharmacy. But I'll do a little bit of a bigger overview from FIP about why we're doing this, why this matters to us, and linking it to some of the previous work we've already done.
Absolutely. No, thank you very much. I think it makes a lot of sense, Lina. So let's start with yours and then listen to Ravi's presentation. So if you excuse me, I'll just introduce yourself for the few of those that might not be familiar with you amongst our audience today. So Dr. Lina Badr is a UK trained and registered pharmacist and is working with the FIP currently as the lead for equity, sustainability policy and development. As part of FIP's leadership team, Dr. Balu leads a number of strategic programs and supports the delivery of FIP's mission to advance the pharmacy profession nationally, regionally, and globally. She supports FIP to achieve the 2030 Sustainable Development Agenda through pharmacy and the FIP development goals, FIP DGs. She also provides focused support, policy analysis and development for the goals around equity and sustainability, as well as the related goal of access. Lina has a key role in the evaluation of implementation of the FIP Global Roadmap on advocacy and outreach activities related to the FIP development goals. Lina, thank you very much. The floor is yours.
Thank you very much. And I see Ravi's joined. Ravi, I'm just going to spend a few minutes doing my own bits and then hand over. The last word will be yours. Thank you very much, Gonzo, for that introduction. Very pleased to be with our esteemed speakers today. I just thought to take a few minutes off of this webinar to talk to you all about why FIP is doing this and some of our programs of work and how that links. So I do hope by now that a lot of people on the call are familiar with the FIP development goals. They are a set of 21 development goals FIP launched in September 2020, almost 2 years ago to the day today. And these provide the world's profession with a framework for transforming pharmacy. And of course, that would be based on the needs and capacities to progress and advance. The last but not least goal, goal 21, is about sustainability in pharmacy. And as with all the goals, each one of our goals contains 3 elements. And we set out our global vision for workforce and education, practice, and science. So in terms of sustainability in pharmacy, workforce and education focuses on strategies and systems in place that utilize the workforce to enhance sustainable pharmacy and services. This is what we'd like to see happening everywhere. In terms of practice, and I think a lot of today's discussion is very relevant to practice, we'd like to see everywhere policies, regulations, and strategies to ensure the sustainability of the environment and minimize the impact of pharmaceuticals and pharmacy practice. The other angle of sustainability in pharmacy of practice is ensuring sustainability of practice itself or the delivery of services through appropriate remuneration models for these services. And finally, the science elements also, we would like to see everywhere scientific strategies and policies in place to maintain the consistent supply of products throughout the life cycle whilst limiting negative consequences for the environment. So this really sums up everything we aim and strive for sustainability in pharmacy. Of course, the scope is much wider than that. If we go to the next slide, I'd like to tell you about our Sustainability RX program, which delivers this webinar with the support of the TCVI. But Sustainability RX is the name we've given to the program of work at FIP that supports the progress and implementation of DG 21, which I've just described. At the moment, and of course the scope of this program changes and is very fluid, we cover 3 areas. One is responding to disasters and pandemics, and emerging from the pandemic, we've realized that pandemic preparedness is a core element of ensuring sustainable services. So we have grouped this piece of work under the sustainability umbrella. The second bullet point on the screen really is the core of what we're doing today, looking at everything to do with environment and planetary health, including climate change. And finally, sustainable services, and how can we ensure the sustainability of the services and the profession itself, which is another angle of sustainability that we also work on at FIP. The next slide refers to some of the work we've done in the past. So a lot of the work we're doing today builds on successes of the past. So I wanted to just mention some of those resources as well. So in May and June 2021, FIP and the Clean Breathing Institute convened an experts roundtable to discuss the global threat of air pollution and its impact on patient care and how pharmacists may contribute to mitigating this important health problem. The first session focused on pharmacy practice at the time and aimed to identify the priority professional services and tools for community pharmacists. And the second session focused on education and training pathways and mechanisms for developing the necessary competencies for these services to be delivered. So of course, we always look at the competency development and workforce preparation angle at FIP at any piece of work we do. Some of the objectives of these roundtables were really to identify priority needs in terms of services and tools, discuss any gaps and how such gaps and barriers can be addressed by FIP and its members, and produce an advocacy piece or call to action to encourage our members and stakeholders to prioritize action in the area of air pollution. In the next slide, you can see displayed some of the key messages that we'd like to highlight coming out of these roundtables and the resultant call to action. So pharmacists, we have agreed, we think are ideally positioned in primary healthcare, especially to tackle air pollution and its impact on respiratory health. We've heard a lot about the health impacts of air pollution earlier, and a lot of these areas pharmacists already have input on. Pharmacy services need to address the effects of air pollution on health, particularly on the vulnerable populations such as elderly, children, and those with chronic respiratory conditions. And these services can include differential support for cold, flu, and other patients. There is a huge gap, we've realized, in pharmacists' awareness of the impact of air pollution. And this explains why we're doing some of these events this series, to continue to raise the awareness in the area. We also think there's a need for pharmacists to be trained and equipped to tackle air pollution, and the training could be delivered through undergraduate and lifelong learning programs as well. There is an opportunity for some community pharmacists to even become more active in this area and become Breathe Better campaign supporters. We are, of course, delivering this during Clean Air Week, and we've launched a campaign with Clean Breathing Institute. You can find out all about it in social media through posts coming out this week. And if you'd like to be more active in the area, please follow the link in the posts, and we'll share that in the chat in a moment, and you can sign up and let us know if you'd like to be part of this. And we have developed a call to action following all this work, which developed the needs to be implemented in a needs-based approach. I'm going to go to the next slide and really pause here and give floor to Ravi in a moment. But this is the FIP call to action on air pollution. I'll share the link in the chat in a moment so you can have a look at that. But it's about mobilizing pharmacists across our communities to mitigate the impact of air pollution and health. And it is the sort of summary of all the roundtables and research we've done through the experts and discussions with them to drive our agenda forward. And in 2022, we follow through from the outcomes of these, build on that, build on these outcomes, and we're trying to deliver activities that can bridge the gap in terms of pharmacist awareness, and also identify and provide more tools to support them be more empowered to act in this area. I'm going to pause and I'll be sharing some links in the chat, but I think I'm going to hand back over to you, Gonzo. Thank you so much, and I'll be very ready to take some questions later on.
Thank you so much, Lina. Indeed, I mean, we are in Clean Air Week this week precisely, and today is the United Nations Day for Clean Air for Blue Skies. So it's a very timely moment for us to be having this discussion precisely around raising awareness of colleagues around the world about the role that they can play. So thank you very much for sharing that, Lina, and for sharing the resources that that we have developed at FIP on the chat box. We'll now go back to our panelist, Ms. Ravijot Sagu, who I've introduced before, so I will not be reading Ms. Sagu's bio again, but I would like to thank you very much for joining the panel today and for presenting an overview of the role that pharmacists can play to address this important challenge of air pollution and the impact that it can have on people's health and our communities. So thank you very much, Ravi, and the floor is yours.
Thank you for having me. I'm aware we've got a mixed audience today, and I am a pharmacist. I have an acute medicine and respiratory background, so I will be speaking with that hat on. If I can have the next slide, please. So we have no plan B, and the speakers before me have really outlined the dangers of global warming and the effect it's having on health as well in terms of air pollution. We've got glaciers that are melting, and in fact, the world is now 1.2 degrees warmer than it was in the 1850s to 1900. And that means that we lose approximately the amount of an Everest amount of glacier each year, which is a hell of a lot loss. We are literally fighting fires, so we need to try to move away from that and actually work more with the preventative side of things as well. We are needing to do some mitigation, and I think that word's come up a lot today, mitigation as well. But we essentially have no planet B as well, so we have to look after what we have. Next slide, please. So we know that there are various different impacts to health, and again, the speakers before me have spoken about that, but particularly there are certain populations who are maybe more underserved that are affected. And I just want to draw your attention to the wonderful documents that the WHO have organised, and they have various toolkits to help try to look at the vulnerability, and you can do risk assessments in your area as well. And we know that the impact to human health is also to mental health as well. So this is important to think about, because the global warming is not happening uniformly. So there may be some countries and some areas that will be affected more than others. If I can have the next slide, please. So we know that there are inequities and inequality, and whether you're across the world or within your own country, for example, here in the UK, we have lots of variation in respiratory outcomes, whether we have patients in a rural setting or in a city setting as well. And the air quality in those areas is different. The access to healthcare is different as well. And you'll be aware of the Lancet countdown report, which is an annual report, is an international collaboration which essentially provides us with information and indicators of how we can improve as well. It's unfortunately just telling us that the inequities are deepening and widening, and we really need to take action. So there was the urgent call for climate action that came out and was put forward at the COP26 event as well. So I think, again, as it's been said, the climate crisis is a health crisis. So how bad do we have to wait before we take some action? And the action that we're taking, is it sufficient? So we need to do more. We need to work smarter and a little bit harder, and think about innovation and the way that we can support this for our future generations and for the time that we have now as well. If I can have the next slide, please. So climate crisis and climate change is beginning to reverse the years of progress that we've made in tackling the food and water insecurity that still affects many different underserved populations as well. And I mentioned rural and coastal and urban variation as well. But this inequity impacts everybody. So it's not restricted to one company. This is without borders. And so the impact is really important. So I'm just going to draw your attention to a couple of policy drivers. And this is specific to the UK, but there are some global things within this as well. So we have many organisations that have made a climate emergency declaration. We have the NHS Carbon Net Zero report that came out in October 20, and we're the first health service to commit to become carbon net zero. We have our NHS long-term plan, which is undergoing a refresh, and it talks about the beginning of life, so before birth, the beginning of life, living your best life, and the end of life. And really we need to think about what that means for our patients everywhere, and think about the journey, so in preconception, conception, and how air pollution is affecting that as well. We have the WHO air quality standards, and we know that there's no safe level of PM 2.5 that is acceptable. So it was really, really shocking to hear some updates at the recent European Respiratory Society Congress just over the weekend as well, of how much, how bad the situation is. But this actually does also provide us with an opportunity to make a difference and take action. So if I think about, again, the UK, we have the National Report on Asthma Deaths, which came out in 2014, and we're not doing very well with our asthma outcomes. And Asthma Lung UK, which is a charity, again, in the last couple of years, said that as England, we'd had the worst outcomes compared to the whole of Europe for asthma. So why aren't we doing any better? And part of this is related to inequity, inequality, but some of it is to do with the climate change and health and air pollution impacts as well. We know that there are various incentive schemes within our pharmacy world here to help achieve certain indicators to improve health, but we need to start building the sustainability element into our incentives and as part of our leadership and governance framework as well. If I can have the next slide, please. I mentioned carbon net zero. So essentially we have direct emissions that are direct actions that affect our carbon emissions and indirect actions as well. And we know where medicines are concerned, there is a considerable carbon footprint from medicines and from the National Health Service. Within that, there are particular culprits. So we know that gases, medical gases, nitric oxide, for example, anesthetic gases, and inhalers are particularly troublesome. If I can have the next slide, please. And within the carbon footprint of these items, we know that it might just be a small amount, 2 to 3%, but there is a large volume of use of these agents, so that does really have an impact. So if I just quickly mentioned, we have a number of the chains of looking at how we decarbonise within the NHS. I won't dwell on this too much, but medicines are an important part, but there are other things that we need to. So we need to really take a holistic view on how we make some real change here as well. And the diagram here shows that if we are able to implement and take the policy actions that are required, then we can just about reach our carbon target before 2040 as well. If I can have the next slide as well. So also, if we are wanting to meet the Paris Agreement, we really need to reduce our greenhouse gases to half within the next decade. And so how realistic is that? And actually, are we doing enough? And from everything that I've seen and heard so far, we really aren't making as much progress as we need to. So I mentioned medicines, and within that, the inhalers, the culprits here are really the meter-dose inhalers. Now, there are dry powder inhalers, which may be a suitable option. So I think the message coming through the Carbon Net Zero report was to consider using dry powder inhaler alternatives where possible, where clinically appropriate for our patients as well. We need to have better mechanisms of how we dispose of our inhalers and think about the recycling element and principles of circular economy. So many inhalers contain mixed plastics, so they're not recyclable. And we don't have one unified scheme across the UK to enable recycling. So there are clearly things that need to be done and things that we can work on. If I can have the next slide, please. So talking about greenhouse gases, there's a variety of different gases, but they essentially get trapped into the atmosphere. They can't escape, and this then causes the Earth to heat up. And a lot of this is through fossil fuels. Some of it is from agriculture, and I've mentioned nitric oxide, but we also have the fluorinated gases as well. These are within air conditioning units, fridges, but also inhalers. And as you can see, they can stay in the atmosphere for a long, long time. And we really want to kind of minimize their use. Next slide, please. So I just want to give you some context now, just to say that using an inhaler isn't a choice, whereas you may want to get in a car and choose to drive a car, and that is a choice you can make. But there are specific inhalers in the UK that are higher carbon emitting than others. So just a couple are modeled here. So giving you an example of meter-dose inhaler, and the emissions from that are equivalent to a very long drive in a car. Across from London to Sheffield, whereas if you look at an equivalent dry powder of salbutamol, it is a much shorter journey, a much lower impact to the environment. And I mentioned about disposal as well. So if every inhaler user in the UK returned all their inhalers for 1 year, this could save a lot of carbon, and that's like going around the world in a car 88,000 odd times. Next slide, please. So it's just giving some context there. So our speakers before have mentioned the impact of respiratory health, so I won't dwell on it, but essentially if we think about how COPD, etc. come about, so COPD is linked to smoking, biomass fuel exposure. So we have people growing up in different parts of the world and moving to different parts of the world. So in England we have, especially in London, we've got quite a transient mixed community, and they've grown up with different exposures. We want to try to divest from fossil fuel use so that we're really limiting the exposure that people inhale. Smoking as well, if we can think about reduction, smoking cessation is probably one of the biggest interventions, if not the biggest, that we can make on somebody's health as well. In terms of asthma and allergies, we know that pollen levels increase, allergens and mold increases, and the ozone and particulate matter, especially at ground level, can really be irritant and cause allergies. If we think about the increase in forest fires now and the smoke from that, this is also irritant, and it travels for very long distances as well. And this can then irritate the lungs and cause more respiratory tract infections. Next slide, please. So what we want to do is think about how we can achieve and support the Sustainability Development Goals, and pharmacists are important as part of a multidisciplinary team. So we all need to work together. It's not one person or one team's issue. This is all of us, and we're in it together. We only have one planet, but essentially we can help to progress working towards these goals by targeting various things, and I'll come on to that as well. So if we can go on to the next slide, please. Hi. So in view of the last slide on the SDGs and thinking about how we're supporting our patients, so where respiratory is concerned specifically, we want to support self-management and shared decision-making for our patients. So if we are thinking about moving away from their metered-dose inhaler or initiating a new inhaler, we need to be able to give patients enough information so they know what they're doing, know what they're getting into, why we're doing this, so that they're not feeling that things are being done to them. So this is important to help them adhere to their treatment, so we get better outcomes in terms of better disease control as well. We want to have responsible use of antibiotics and steroids. So where exacerbations are concerned, again, it's about prevention, it's about that self-management, so patients are also empowered. And we want them to be part of the change that we're making here as well, because it's not something that we can do alone. We have to get that engagement and allyship from them as well. So inhaler technique and adherence clearly important so that we can get good stability of disease control. And thinking about the different interventions, so medicines are only part of it, and if we think about inhalers, only a small part of the inhaled drug actually gets deposited in the right parts of the lung. However, smaller particles, PM 2.5, get deposited, and we want to avoid that as well. So thinking about the indoor air quality and as well as the outdoor air quality as well. And we know that well-being measures, physical well-being, diets, exercise, etc., that's going to be better for the patient. So in England, we have our British Thoracic Society, and there's a position statement on the environment and lung health, also air quality and preventing future deaths, and the Children's Lung Health Charter as well. Next slide, please. So shared decision making is important part of these discussions. So what we're not wanting to do is for pharmacists to do routine switches away from one inhaler to another. We need to have a considered discussion so that patients aren't unintentionally destabilized. And pharmacists are the holistic drug dealers. So whilst we are medicine specialists, actually we do a lot on prevention and treatment and non-drug interventions as well. So I like to think of us as health and wellbeing practitioners. So we want to think about what the bigger picture is and what we can do. We're not limited to working behind a counter in a pharmacy or in a hospital. And so one of the easiest things that we can do to start with is to make a pledge of our own personal action and understanding our own carbon footprint. And there's ways of calculating that, though WWF are one of the places you can have a look. But I think it's also about starting a Mexican wave and trying to learn a little bit more, and really having that allyship and advocacy. So joining a community of practice or setting up one as well, really important to help us to understand and contribute to guidelines and policies actually in your local area and also beyond that regionally and nationally. Next slide, please. So we have various so in the UK, we have integrated care systems, which are larger areas where we have to have a green plan and a sustainability plan. So actually, do pharmacy have one within that and in your local area? So you might not have an integrated care system, but what is going on around medicines and sustainability. So we know that medicines, packaging and plastics have increased, and that's not looking like it's slowing down. So what changes can we make? So this is a good quality improvement or lean project that we can be involved in. I spoke about disease control. So I think whilst we're thinking about the environment, we want patients to understand why we're doing things so that, again, they're part of the change, and that's that Mexican wave. And you'll be surprised about how much power we have. So using our platforms and our voices as well. So like the UK, you probably have a catalogue or formulary of medicines that are approved or allowed. We have slightly different funding systems here. So we don't want to prescribe medicines that could be high carbon emission. The problem is that we don't have enough data on all of the medicines and how much their carbon emission is. So starting to get that information is going to be really useful, and sharing and working across boundaries as well. Really important for raising awareness with our nurse colleagues who might be doing some of the prescribing or that education with patients, but also others as well. So again, working as one collective voice to help make a real impactful difference here. I mentioned disposal before, so many patients don't know how long an inhaler lasts and how they should dispose of it, and often gets put into the domestic waste, which we don't want. So we need it to come back to pharmacies so that the gases can be incinerated. And as I mentioned, what is your local pharmacy sustainability strategy? Do you know how we can actually help with recycling and disposal in your area as well? Next slide, please. So I mentioned the inhalers and the greenhouse gases. So there are new inhalers along the way, and there are many inhalers in the UK actually. So actually not having too much choice not always a good thing. But where we can use lower HFA propellants within the MDIs, this is an alternative. But ultimately, if we can keep patients better controlled and avoid exacerbations, then that means that they need to use certain maintenance therapies regularly and not rely just on short-acting salbutamol or other short-acting agents, which is unfortunately the case in the UK. There's an overuse of SABA. Thinking again holistically of how we and our patients operate. So do we need to work in the way that we do work? So do we need to travel using cars? Can we take different journeys, avoid idling of the cars, and having more plant-forward diets and ways of living? And people don't necessarily want to become vegan, but even if you're able to cut out your meat consumption, that's still really important as well. There was a mention of a call to action and various pledges, so be part of that. Please start that Mexican wave, be part of that change in your local area. And I mentioned mitigations and advocacy. I think a lot of this comes also into leadership and governance and teaching. So if we're teachers, if we are lecturers, to bring this into the curriculum, to let people know from early on as well. So we have lots of responsibilities, and with the title of a healthcare professional, whether it's pharmacist or otherwise, there's a big responsibility that sits on our shoulders and comes with it. So just thinking again how our fossil fuel use, the fires, the heating up of the planet is going to increase water, air, food and vector-borne diseases and transmission, so cholera, malaria. So anything that we are doing to prevent that or minimize the impact is in the long run going to help us avoid unnecessary prescribing and keep people better. And we've got to think about our future and our generations to come. So I think that's my last slide. Yep, that's it. Lovely. Thank you very much. I'll stop there. So responsibility sits with all of us. So what are you going to do? What's your pledge after today's session? Thanks.
Excellent. Thank you so much, Ravi, for that brilliant presentation. And I think that with your presentation and Dr. Shang and Dr. Salvi is as well, and Lina's. I think these are excellent triggers to start that Mexican wave. So we do encourage all our colleagues on the call today to take the challenge and really implement some of these measures into their daily practice. For example, by identifying what are the main sources of air pollutants in your communities, because they may vary in terms of indoor air pollution, use of fossil fuels, cleaning products or other products that are used in households, but also ambient air pollution, as Dr. Salvi highlighted as well. So what are those sources and what can you do to help people minimize the impact on their health? So I will now ask my colleagues maybe to stop sharing the slides and ask all the panelists to switch on their cameras so we can we still have some time for some questions and a nice conversation. Thank you all very much. And so maybe I will start with a question that we've mentioned. I believe it was Professor Chung that mentioned the use of masks and nasal, or Professor Salvi maybe, that use of masks and nasal hygiene as measures to protect people from the impacts of air pollution and particulate matter suspended in the air. We're just emerging from a pandemic, and many people are sort of willing to get rid of the masks, and maybe they're not fully aware of the another big threat that may be present on a daily basis that is not really linked to a respiratory virus. How would you consider, how important is it to really wear a mask, and when should pharmacists truly advise on the use of masks and nasal hygiene measures, depending, for example, on the levels of air pollution that may vary on a daily basis? And perhaps you may also refer to the types of masks that you might recommend. Dr. Salvi, would you like to maybe start?
And such wonderful presentations from all faculty. One of the points that both me and Professor Panchung raised was one of the means by which we could protect ourselves from the harmful effects of air pollution is to wear masks. We have just come out of the COVID pandemic, and one of the good things that has come out of the COVID pandemic is the fact that the behavioral changes of people were quite surprising. People from all over the world started wearing a mask, which was quite amazing. Even for a country like India, to convince people to wear a mask was not easy, but the fear of the COVID pandemic actually changed the behavior. Now, what we should continue doing is to continue wearing the mask, not for pollution. So air pollutants were one of the main reasons for why the masks were introduced. And we should now continue doing that. The N95 mask is probably the best one that
I believe we're having some connection problems with Dr. Salvi. Dr. Salvi, can you hear us?
To add something to this.
Dr. Salvi? Yeah, maybe Professor Chung, maybe you can comment in the meantime.
I think Dr. Salvi was going to mention the use of N95, and particularly switching on to those masks that will prevent the penetration of those PM 2.5, as we've heard, as very toxic to the lungs. And the N95 are the masks with those filters that will capture the PM 25 that you inhale. If I might add another comment to the general consideration of wearing masks, I think it is important to realize that there's always been an east-west the world different in terms of using masks, and we all know that in the East, in countries like China, Hong Kong, and Japan, during the winter season, most people wear masks when they travel communally, because they realize that during the virus cold or flu season, this is a means by which you prevent yourself from getting infected in the crowds. And also it works the other way. If you do have flu, then you don't spread it. And I've just come back from this big meeting we had in Barcelona. And it was quite clear that in the meeting, the people still recommended that everyone wear masks when you meet, like in big meetings. We just came back from, but very few people were wearing masks, including myself. So I think there probably is a cultural difference, East-West, and whether we should try and get into much more middle road in terms of wearing masks, either for preventing the effects of pollution or getting infected or preventing the spread of virus infection in particular, I think is something that we want really to discuss, and whether there is something there. I guess at the end of the day, if there were some evidence to support the use of the mask, I think that would really help. And I think as pharmacists, talking to pharmacists now, I think this is something that would help pharmacists to spread the word about masks, if we can get good supportive evidence for its use in those situations.
Thank you very much. Ravi, I would ask you about, in addition to the use of masks, what could be the role, for example, of nasal hygiene, and how could pharmacists, for example, help promote it, or, for example, by recommending products or technologies or systems or devices that can be used in promoting nasal hygiene, and what is the evidence for that?
Yeah, thank you. So I also agree that masks are beneficial, and again, N95 or FFP2, but again, it depends on the access. These are costly and not everybody can access these things as well. And also there is a concern about the particles and plastic filaments that might be inhaled, and that's a separate conversation. But in terms of nasal hygiene, we know that the airways start with the nose, so we need to think about targeting that, especially where allergy is concerned. And use of saline douches, saline to wash out the nostrils, that's a very cheap, effective way of sort of sterilizing the airway. And there's plenty of evidence on that, and that can be done easily at home. So if people can't buy a particular product in a pharmacy or over the counter, they are able to prepare their own sterile solution and do that at home. There is actually a nice video on the NHS website of how to do a saline douche and how to prepare that as well for information.
Excellent. Thank you
if people don't have that, even just at the end of the day when they're brushing their teeth before going to bed, to just wash out the nose, even that is going to help to clear out, because if we think about what the nose is doing, it is humidifying, it's acting as a filter. So if that's clogged up, then more particles and other viruses, etc., more likely to get in. Also, just another point, when the weather is cold, to have the nose covered up, because again, it's part of the airways, and when it's cold and then effectively a little bit frozen, it's not able to work as effectively as well. So whether that's a mask or even a scarf, some sort of covering to protect the airways.
Absolutely. Yeah.
Can I just add something very quickly from what the Professor has mentioned about this? And I think one good analogy, I think we really ought to be thinking about cleaning our nose, just like we brush our teeth every morning and every evening. I mean, when we brush our teeth, we don't just wash the teeth, but we also rub it with some ingredients, toothpaste, which contains goodies. It contains like fluoride and so on that makes your teeth strong. And I think we should start doing the same concept with the nose. I mean, at the moment, we advocate, washing the nose with salt solution, saline solution. But I think there could be more than that can be done. I mean, you could put things in the solution that may protect the lining of the nose from being attacked by viruses or for being attacked by pollution and so on. I think, well, that's for the future. But I think the concept of, in nasal hygiene, I think it may be something that could be introduced that everybody perhaps could consider as a ritual as we do for our teeth.
Absolutely, that's a great suggestion and something that pharmacists can definitely advocate and support their communities with. We have a question in the Q&A that is also related to the use of masks. And Ravi was just mentioning that maybe the use of N95 or FFP2 masks might not always be affordable or accessible by everyone, especially in lower and middle income countries. And there's a question about whether wearing a mask throughout the day might be harmful. There's two sides to this question. One of them is the duration of the effectiveness of a mask, but also the duration, whether the duration of always wearing a mask throughout the day, whether that might be harmful in any possible way.
If I can take that without my video.
Soon to be back.
Yeah.
Hi.
Yeah, I think that's a brilliant question. What is the duration of a mask? If you consider the N95 mask, you can wear it only for up to 6 to 8 hours if you're wearing it continuously. After that, the efficacy of the filtering process goes off, and you may actually be more vulnerable to inhaling more viruses or pollutants because the filters get clogged with these particles. So that's the life of an N95 mask. I see a lot of people using the same mask for days together, which is certainly not a good idea. Now, whilst the N95 mask does a good job with 95% filtration, the surgical mask that we use, it's not bad. It's not as effective or efficacious as the N95. It's around 80% effective, but you can wear it for 6 to 8 hours a day and dispose it off. They're cheaper, and therefore you can wear a new mask every day, especially if you're going out. Affordable, and although not 100% effective, but at least it gives good protection up to 80%. Yeah.
Yes, I think the use of masks for pollution, I mean, in areas like, as you mentioned, Sandeep, in India, and I've been to India myself in New Delhi. I mean, the level of pollution there when you walk on the street is very high, and you might be wearing a mask for hours. When you, the other thing also is whether you need to wear a mask when you're in the home. We're now increasingly realizing that there's home pollution, and that leads to the idea that whether in the home we need to be using, those air purifiers. And I think that there's an increasing need for this with increasing pollution.
Thank you, Professor Chang. Actually, there was a question on those devices precisely, so I think you've addressed it. Ravi, sorry.
No, I was just going to say also, I guess it kind of depends on, where you're wearing the mask as well. So as healthcare professionals, if you are in an area where there's not going to be that many air changes, 6 to 8 hours wouldn't necessarily be a safe limit. It might need to be sessional depending on what you're doing. As well, but I think a good way to explain to people is think about your mask like underwear. Once it's on, it's on. It needs to fit properly. Mustn't touch it. It needs to be changed daily as well. So that's a kind of nice way for people to remember that. But it may need to be changed, sooner than that as well. Also, if there are cloth masks that people have made themselves, again, try to have good coverage. But also, if you iron the front and the back, that's going to kill any bugs that are on there as well. So try not to touch and transfer.
Excellent. That's a very good tip as well. Thank you very much. We do have a question about the use of powdered inhalers that you mentioned in your presentation, Ravi. The question is, how can the powdered inhalers be used? But I think that beyond that, how much is of an alternative, how much of a solution to the pressurized inhalers are the powdered inhalers? Are they a real alternative, or the clinical situations and effectiveness is not comparable? What would you like to comment on that?
So I think that there's a number of things. The focus is very much on asthma here in the UK, where the switches are concerned. However, inhalers, whichever respiratory condition it is, the metered-dose inhalers, they contain those gases that can be detrimental to the atmosphere. So we know that. Often people don't have the correct inspiratory pull to be able to use the metered-dose inhaler correctly anyway. So often a change to a dry powder is going to be more beneficial. That's why I'm saying it has to be shared decision making. It's a holistic approach. It's not just about the inhaler. It's using what's clinically appropriate for that patient, the lowest carbon alternative if the patient is in agreement, and having some follow-up if you are initiating something new or changing, so that you haven't unintentionally destabilized the patient and that they can use that inhaler. So it doesn't matter how expensive or fancy it is, if it's not going to be used correctly and the patient can't use it and adhere, then it's not going to be beneficial. And then if you have a destabilized patient who's exacerbating, they're going to then require more healthcare utilization and represent with exacerbations and poor control. So I think it does provide an alternative, and there is a marked difference in the carbon emissions from dry powders. So that is something we should be looking to, and lower propellant options in future.
Thank you very much. And maybe a question before we wrap up. In terms of how do you think FIP and national pharmacists associations around the world, how may they support pharmacists with this new role, or this role in minimizing the impact of climate change and air pollution on people's health? I mean, we've been producing a series of resources that Lena has shared and mentioned in her presentation. But what do you think we might prioritize in terms of supporting pharmacists and their organizations? And Lena, you're welcome to share any plans or to comment on that as well, of course.
I've got a couple of things I can quickly say to that. So I think, and I referred to it within my presentation as well, it's about getting involved as well. So what are your local guidelines? What are the regional and national guidelines? What are the frameworks? And one of the things I've been looking at here is leadership and professional curricula. So what do we have within that? So in pharmacy, there isn't very much currently in the UK. So we're trying to redress that, to say, look, these are the gaps, but we need to learn, you know, as children growing up, but also as healthcare professionals from our early undergraduate stage, what this means for us in leadership, so that we can really help with that adaptation and helping take things forward. There's obviously the resilience, the EPR, so emergency preparedness and planning. So how much are pharmacy involved with the plans within that locally and nationally as well, to be able to mobilize their resource and yeah, for that.
Excellent, thank you so much. Any final thoughts, Professor Chung, Dr. Salvi?
Yeah, I mean, the use of a mask or nasal lavages are potentially good solutions to mitigate the air pollutants that enter into your respiratory system. So doing more research on that, advocating the use of these once the scientific evidence is robust and sound, and overall advocating and educating all the pharmacists about the harmful effects of air pollution and climate change on the respiratory system. I think that's going to be crucial. And I think these are the priorities that I would suggest.
I might just add to this. I mean, I think in terms of climate change, the other thing that I think we've all mentioned, the aspect of climate change, which relates to, you know, the increase in temperatures, hot weather that's going to happen, spread in the world. I mean, we already have hot weather, you know, in places like in Arabia and so on, but the rest of the world is going to have to get used to this. And pharmacists, I think, will again have an important role in advising people how to cope with this hot weather. And as I mentioned, also how will have greater detrimental effect on respiratory diseases like asthma and COPD, and also on the incidence of infections, viral infections, or even pneumonias. And that's another important aspect of climate change
Absolutely.
that's going to affect us.
Thank you so much.
One last point
Lina.
for me is
Oh,
that
sorry.
I think we all just need to lead by example as well. So, be the change that we want to see in the world.
Thank you so much. Absolutely. Lina, with that, what are your final thoughts and how can we be the change that we want to see in the world from an FIP perspective?
Well, there's a lot that can be done, and this is always FIP's question, is what can we do? And I think it's about focusing on specific areas where we can have maximum impact. We can support nations through our member organizations to advocate for these changes and strategies locally. I think working with our individual members, we can, and I think everybody's agreed on this, I think we need to provide tools, educational resources to raise the awareness of pharmacists and what they can do. And just continue to, I think year on year, event on event, we have more participation, more input, more interest in pharmacists. So I think continuing to deliver such educational webinars with experts such as the ones we've had today is a must, in addition to continuing to push out tools, frameworks, resources, and calls to action. We'll do what we can.
Thank you so much, Lina. And we're coming to the end of our webinar. I just would like to finally thank all our speakers and panelists today, Professor Chan, Dr. Salvi, Ms. Sagu, and Lina for the excellent presentations and lively discussion and very relevant answers to the questions from our audience. So thank you so much. I invite everyone to check any future digital events. FIP has an ongoing program of digital events that if you're not familiar with it yet, please visit our website, events.fip.org. And also, if I may have the following slides. So as we were saying, this is clean. Can I have the previous slide, please? Thank you. Clean Air Week. So we're starting the Clean Air Week. So a number of activities and are planned for this week. And so watch out for these activities and register with the link that Lina shared on the chat box. And finally, if I may have the final slide, next week we will be starting, or in a few days, our World Congress of Pharmacy and Pharmaceutical Sciences in Seville, Spain. So if you still have the opportunity, you're welcome to register and join us in Seville to address the theme, Pharmacy United in Recovering of Healthcare. And so just to wrap up, the program or the main topics that will be addressed at this Congress include never wasted crisis, learning for future preparedness for future pandemics, science and evidence supporting the response to COVID-19, and also dealing with new and extraordinary ethical challenges. So we do invite you to come and join us in Seville and learn more about the Congress at our website. So thank you very much and have a great rest of the day or night. Goodbye. Thank you.